Everyone is excited to buy a car, but what if I tell you car accidents are the leading cause of spinal cord injuries? Not only that, even bullets. Okay, what happens if a person is shot on the head? They die. But what in case it happens in the spinal cord? We shall find out. Okay, spinal cord injuries has many aggravating factors, one of it being car crashes, shot bullet wounds, knife stabs, WrestleMania. Those who love acrobats, probably they may end up having the spinal injuries because, yeah, it's a sport, it's an entertaining sport, but look at the negative side of it. These people do very dangerous stunts which may lead to them having this spinal cord injuries. Okay, let's get into it.
Spinal cord injury is damage to any part of the spinal cord or nerves at the end of the spinal canal. Often causes permanent changes in strength, sensation, and other body functions below the site of injury. If you have recently injured your spinal cord, it might seem like every aspect of your life has been affected. You might feel the effects of your injury mentally, emotionally, or socially. Okay, so many scientists are optimistic that advances in research will someday make repair of spinal cord injuries possible. Such studies are ongoing around the world. Yeah, that's good. In the meantime, treatment and rehabilitation allow many people with spinal cord injuries to lead productive, independent lives. Okay, so spinal cord injury is divided into two: complete and incomplete spinal cord injuries. Complete spinal cord injuries is when the failing sensory part of the spinal cord and all ability to control movement are lost below the spinal cord injury. Your injury is then called complete. And incomplete spinal cord injuries is when some motor or sensory function below the affected area of your injury is incomplete. There are varying degrees of incomplete injuries. Additionally, paralysis from a spinal cord injury can be also classified into as tetraplegia and paraplegia. In tetraplegia, also known as quadriplegia, means that your arms, hands, trunk, legs, and pelvic organs are all affected by your spinal cord injury. And in paraplegia, this paralysis affects all parts of the trunk, legs, and pelvic organs. Remember, the higher the level of the spinal cord injury, the higher the rate of life-threatening it might be. So this means the spinal cord injuries in your lumbar might be not that life-threatening than the spinal cord that happens on the cervical part of the spinal cord. Okay, signs of symptoms of spinal cord injuries include extreme back pain or pressure in your neck, weakness, numbness, loss of bladder or bowel control, difficulty with balance and walking, impaired breathing after injury. So when to see a doctor is when numbness and paralysis have come gradually. So that's when you see your doctor. Okay, hakuna treatment kwa spinal cord injuries, but the doctors use rehabilitative measures to see you return to your normal life. Like utapewa physiotherapy, utafanyiwa physiotherapy, utaangaliwa diet review, utapewa medications ya kureduce pain na kureduce the threat of the disease, but kupona is very minimum and very few people have survived, have come out of these spinal cord injuries.
Thanks for tuning into Max Medicare. We've learned what spinal cord injuries are, aggravating factors, what it's caused by, and how it's dealt with in the medical part of field where probably I'm involved. So, okay, in order to prevent this to happen to anyone, please take precaution in sports like rugby. Stop wrestling. Kataza watoi kucheza mambo na wrestling because that's a professional sport. So don't drink and drive. Please kunywa Fanta ama Coca-Cola drive. And thank you for tuning to Max Medicare. Check for more videos like this. Gracias.